Hello, everyone. Good evening. My name is Ken, and let me take this opportunity to introduce you to our episode today. And today we are going to discuss about TB. And TB is an abbreviated word for tuberculosis, and in Kiswahili they call it kifua kikuu. And I'll start by defining for you what TB means. So TB or tuberculosis is an infectious disease that primarily affects your lungs and can also affect other parts of the body. The bacteria that is responsible for causing TB is called Mycobacterium tuberculosis. Now, when I was defining about TB, I mentioned that it is a disease that is primarily affecting your lungs and can also affect the other parts of the body. That means we have two classification of TB. Number one is pulmonary TB. Pulmonary TB means it is affecting your lungs. Number two, it is extrapulmonary TB. That means it is the TB that affects other parts of the body or organs now apart from the lungs. Example of extrapulmonary TB, we have TB meningitis, that is the TB that affects your brain. Number two, we have TB abdomen, or sometimes they say TB peritonitis. Number three, we have TB of the bones or TB spine. And then we have TB adenitis. So those are the forms of TB that falls under extrapulmonary TB. Now, let's talk about the signs and symptoms of TB. And when we say signs and symptoms of TB, signs are the things that you see in a patient. Symptoms are the things that patient will tell you when they visit your facility. So signs and symptoms of TB include, one is cough. And cough, in this case, we mean a cough of any duration. And there is chest pain or chest tightness. Number three, we have loss of or unexplained loss of weight. We have anorexia. We have night sweats. We have loss of appetite. We have low-grade fever. So those are some of the signs and symptoms of TB. Now, any patient who present to the facility or who present to the outpatient department with the signs and symptoms that we have mentioned, like now the cough, that patient is declared as a presumptive patient, or that patient qualifies to be done screening for TB. I know your first impression will be upper respiratory tract infection, or maybe after doing your examination of the chest, maybe you will make an impression of pneumonia depending on your findings. But now keep in your mind that this is a patient who has presented with signs and symptoms of TB. And don't be in a hurry to start this patient on these common antibiotics. It is good you screen for TB because they are presumptive. And presumptive means they have presented the signs and symptoms of TB. As much as you want to treat this patient for upper respiratory tract infection or pneumonia, can you also rule out TB by doing the investigation? Now, when we talk about the investigations of TB, according to the WHO current guidelines, the sputum gene expert or the gene expert is the first recommended test for TB. Gene expert is a molecular test that uses the sputum in detecting TB. And gene expert is a new test that was actually found recently, and not like in the past where people used to do microscopy and the chest x-ray as the first test. Nowadays there is gene expert, which is a molecular test for detecting TB, and it's a test that takes about 3 hours, and it has high sensitivity and specificity, and that's the test that the WHO or World Health Organization actually recommend to be done as the first test. Number two is we have the chest x-ray. Now the chest x-ray actually is it's an imaging done on your chest, and it's actually helping us to see how the lung feels looks like, and if there is any features of TB. Number two or number three, we have other tests like now ESR, and then also we have the microscopy. And for microscopy, we don't rely so much nowadays. Initially, we used to do microscopy as the first test, but nowadays it is used for monitoring patients during treatment. Like now, you've sent a patient for sputum gene expert, and the results now comes positive. You start the patient on treatment after the first 2 months. Remember, we are treating this condition or this TB for 6 months. So for the first 2 months, uh, if the results of the patient is positive now for gene expert, you start the treatment. After 2 months, you need to make follow-up for that patient by now using the microscopy, sputum microscopy, to monitor the patient during the treatment. That is the month 2, 3, 4, and 5 until they complete their course of treatment. Now, the other test is the HIV status. The HIV status. The HIV status in this case, it is actually helping you to investigate around your diagnosis or your impression, because a patient will come complaining of a cough for more than 2 weeks, and maybe they're having general body weakness. So you are trying to investigate what could be making this patient to have a low immunity, which is actually making him or her to be at risk of getting diseases like now what we are talking about, that is TB. So HIV test is very important. Another test also is the random blood sugars. And any patient with a terminal illness like cancer, like hypertension, like diabetes, or maybe a seroreactive patient or HIV positive patient, they have low immunity. And now, and when you do the random blood sugars, it is very important, because if they are diabetic, that means their immunity is low and they are at risk of getting TB. So those are the tests that will help you to investigate around. There are some other tests like now ESR, or erythrocyte sedimentation rate. The normal ESR is 0 to 10, or around 10, 0 to 10 or 0 to 20. So sometimes when you do ESR for a patient with who is presumptive, sometimes you get the ESR is actually high. It's more than 100. That shows there is a lot of inflammation in your body, or there is a condition actually that is causing illness in your body, and that's why the ESR is actually going above, extremely above the normal. Now, after doing that, after doing those tests for your patient, it is now time to make your diagnosis. Now, and in diagnosis, diagnosis actually they are divided into two. There is bacteriological diagnosis, and there is clinical diagnosis. Bacteriological diagnosis means a patient has come and presented the signs and symptoms of TB, and you've taken the sputum from the patient, you've sent for a gene expert, and the results now come positive. So that is bacteriological diagnosis. The gene expert results is positive for Mycobacterium tuberculosis. So that is one. Number two is a clinical diagnosis. Some of our patients, they come to our facility, they complain of a cough. Many a times they complain of a dry cough, and sometimes it is hard to do sputum gene expert, and that means you are going to rely on the other test, like now the chest x-ray, and maybe after doing the chest x-ray you realize that the patient is having a suggestive x-ray or having features of TB, but now you cannot do sputum gene expert because the patient is not able to produce sputum. So you can still make diagnosis of TB by using a chest x-ray findings, and then you start the patient on treatment. So when you